In a recent survey by the CDC of high school students, about 1 in 5 had seriously considered suicide, 1 in 6 had made a suicide plan, and 1 in 11 had actually made a suicide attempt. Hi, I'm Dr. Mark Schechter, Chair of the Department of Psychiatry at Salem Hospital, and today I'm going to fact-check some claims and common perceptions about suicide. There are a lot of claims and misconceptions about suicide, and today I'd like to clear some of them up. Fact check. A suicide attempt is a cry for help. This is mostly false. Most people who attempt to die by suicide do so because they just can't bear how they feel, and they see no other alternative to escape this unbearable feeling. Sometimes in these situations, what seems like a very small gesture of kindness, connection, reaching out, can make a very big difference and even be life-saving. Fact check. A good psychiatrist or other mental health clinician should be able to predict suicide. This is false. What a psychiatrist or other mental health clinician can do is do a good suicide risk assessment. This includes looking at somebody's current presentation, like have they had recent suicidal thoughts and behavior? Are they feeling hopeless, despairing? Have they communicated thoughts about suicide to anyone, or made any preparations for suicide, like writing notes or giving away possessions? And also, there are things about someone's history. For example, have they made a suicide attempt in the past? Or have they come close to making a suicide attempt? But even with all this, you just can't always know, even as an experienced, highly trained clinician. Fact check. Suicide is preventable. This is both true and false. In some ways it's true because there's so much we can do to prevent suicide. We can reach out to people who are in distress. We can treat depression and other serious mental illness. We can take steps to keep people safe, even when they're having suicidal thoughts, and we can make the environment safer by limiting access to lethal means. But it's also false, because if we can't predict suicide, even the most highly trained psychiatrist is unable to predict in an individual case who is and who is not going to try to die by suicide, then we can't always prevent. And this means something very important, that every suicide is not someone else's fault. And this includes loved ones, friends, colleagues, and professional caregivers. Fact check. If you stop someone from killing themselves one way, they'll probably find another. This is false. Many suicidal acts are impulsive. In fact, 25% of people who make serious suicide attempts say the time between deciding to act on their suicidal thoughts and acting on them was less than 5 minutes. Making someone's environment safe has been repeatedly shown to work. If we can take away someone's preferred lethal means, that means having them not have access to a gun, having guardrails on high buildings, having barriers for bridges. Most people do not look for other methods and kill themselves in other ways. So these efforts can be life-saving. Fact check. A person who wants to die by suicide is probably going to do it eventually. This is false. Actually, suicidal states tend to be transient. They pass with time. About 90% of people who make even the most serious suicide attempts do not go on to kill themselves. They go on to live their lives. Fact check. A lot of people have suicidal thoughts at some point in their lives. This is true. What we call passive suicidal thoughts. Thoughts about, I just feel so bad, I wish I were dead. If I didn't wake up in the morning, that would be fine. Those kinds of thoughts are actually a common, though usually transient, human experience. In a recent survey by the CDC of high school students, about 1 in 5 had seriously considered suicide, 1 in 6 had made a suicide plan, and 1 in 11 had actually made a suicide attempt. So we need to get comfortable talking about this and help people get help. Fact check. Asking a depressed person about suicide may put the idea in their heads. This is false. Asking someone about suicidal thoughts does not suggest suicide or make it more likely. In fact, when someone is struggling and feeling alone and desperate, an open discussion is more likely a relief than anything else, and is more likely to diminish the risk rather than raise it. Fact check. There's no point in asking about suicidal thoughts, because if someone really wants to do it, they're not going to tell you. This is false. The characteristic state of someone who's feeling suicidal is not that they 100% want to die. It's that they want to die because they can't bear how they're feeling. This is their only escape. But there's usually a part of them that actually wants relief some other way, that wants to get help, that wants to live. Most people will talk about their thoughts when asked, and it can be a huge relief, and for some people even life-saving. Fact check. Most suicides are out of the blue without warning. This is false. Most people who are struggling with suicidal thoughts do communicate in some way. This can be in the form of direct statements, acknowledging to someone that they're having suicidal thoughts. It can even be in the form of jokes or hints, like, well, we'll see if I'm here or not. It's important to take any communication about suicide, even if it's delivered with humor, very seriously. Fact check. My friend often hints about suicide, but he's never acted on it, so I know he doesn't mean it. This is false. Dangerously false. Some people think that the people who talk about suicide are not the ones who do it. This is wrong. It is true that having made a suicide attempt in the past is a very strong risk factor for suicide. But recent studies have found that almost 2/3 of suicides occur on the first attempt with no prior attempt. Fact check. Only someone with a major mental illness would ever try to kill themselves. This is false. It is true that most who die by suicide have depression or some other psychiatric illness, but this is not always the case. For some people, there can be an experience that feels so catastrophic that it leads to a sudden state of despair, desperation, and entrapment, a feeling like there's just no way out. This could be a sudden loss, or it could be some kind of reversal, like an investment banker who suddenly loses everything and whose self-esteem completely collapses and feels he can't face his family and friends anymore. Fact check. My friend just lost a family member to suicide, but if I say anything, I know it'll just make things worse. This is false. The loved ones of a person who died by suicide are experiencing catastrophic grief, and it's complicated by intense emotions: guilt, shame, self-blame, anger at the person themselves. It's a very complicated grief situation. And what they want and need is what everyone who's grieving wants and needs. They want human connection. They want people who care about them to reach out and show compassion. Fact check. We all have a role in suicide prevention. This is true. We all have a role to play. We need to listen when a friend or colleague or loved one seems to be in distress. We should pay attention to signals about hopelessness, worthlessness, and be willing to ask what's going on and ask about whether someone's having suicidal thoughts. If someone is having specific suicidal thoughts or a plan to kill themselves, then this is an emergency and they need help right away. This could include calling 911 or bringing them to the nearest emergency department. Thanks for watching our fact check on suicide today. I'm Dr. Mark Schechter from Salem Hospital and Mass General Brigham. If you or anyone you know needs help, please look at the resources below.